My name is Sarah Jenkins. I'm 24 years old, and as I screamed in agony on the hospital gurney, convinced my appendix had burst, the nurse ripped off my leggings, looked between my legs, and froze in absolute horror. The sterile smell of the emergency room seemed to vanish, replaced by the metallic scent of blood and the deafening sound of my own heartbeat hammering against my ribs. I grabbed the railing of the bed, my knuckles turning white, and screamed again as a wave of pressure threatened to split my body in two. "What is it?" I shrieked, tears blurring my vision of the fluorescent lights above. "Is it a tumor? Am I dying?" The nurse didn't answer me. She hit a red button on the wall, and the room was suddenly bathed in flashing lights as an alarm began to blare. She looked up at me, her eyes wide with a mixture of panic and confusion, and shouted words that made absolutely no sense. "We need a delivery tray. Stat, there's a head. The baby is crowning." I stopped screaming. The room was spinning, but for a split second, silence rushed into my ears. "Baby," I whispered, the word feeling like foreign grit on my tongue. "No, that's impossible." I looked down at my stomach. It was flat. I had been wearing high-waisted skinny jeans 10 minutes ago. I had taken my birth control pill that morning with my oat milk latte. I had just finished my period 3 days ago. "You're wrong," I yelled at her, trying to kick my legs closed, trying to stop whatever was happening to me. "I'm not pregnant, I'm sick. Help me." "Honey, look at me," a doctor shouted, rushing into the room and snapping on latex gloves. "I need you to push. The shoulders are stuck." Push. I didn't want to push. I wanted to wake up. But then I felt it. A rip, a burn, a sensation of sliding that defied every law of physics I thought applied to my body. I let out a guttural roar, not of effort, but of pure, unadulterated terror. And just like that, my life ended. Please be aware that this story contains descriptions of traumatic birth, temporary dissociation, and postpartum mental health struggles. If you've ever felt like your own life was a movie you were watching from the wrong side of the screen, please subscribe and share your story in the comments. I need to back up, because you're probably thinking exactly what my boyfriend, Mark, was thinking in that moment. You're thinking I'm a liar. You're thinking, how does a woman carry a child for 9 months and not know? I was 24. I was a junior art director at a marketing firm in Chicago. I worked 60 hours a week. I went a spin class on Tuesdays. I drank margaritas on Fridays. I lived in crop tops. Mark and I had been together for 3 years, and we had a 5-year plan. Year 1, promotion. Year 2, move to a bigger apartment. Year 3, maybe a dog. Year 5, discuss marriage. Kids were somewhere around year 10, if at all. I was diligent. I was careful. In the 9 months leading up to that night in the ER, I had lived a normal life. I had periods. They were lighter, sure, but I attributed that to stress at work. I hadn't gained 40 pounds. I had gained maybe 5. I looked a little softer around the middle, but I just switched from size 4 to size 6 and cut back on carbs. I never felt a kick, not once. Just some gurgling digestion, usually after I ate spicy food. So when I woke up that Tuesday morning with a sharp pain in my lower back, I took some ibuprofen and went to work. By 5:00 p.m., I was doubled over at my desk. By 7:00 p.m., Mark found me on the bathroom floor of our apartment, vomiting from the pain. "It's a kidney stone," Mark had said, his face pale as he helped me into his car. "My dad had one. He said it felt like getting stabbed." "It feels like I'm being ripped apart," I sobbed, clutching my stomach. The car ride was a blur of red taillights and Mark's hand squeezing my knee. "Hang on, babe," he said, his voice trembling. "We're almost there. They'll give you something for the pain." I remember looking at him, seeing the worry in his eyes and feeling a surge of love. He was my rock. I had no idea that within the hour, he would look at me with disgust. When we got to the ER, the triage nurse was skeptical. "On a scale of 1 to 10, she asked, barely looking up from her clipboard. 20, I screamed, gripping the edge of the desk. Something is exploding inside me. She sighed and typed something into the computer. Sit in the waiting room. We're full. I can't sit, I yelled. I need a doctor. And then I felt the pop. Water gushed down my legs, soaking my jeans and pooling on the linoleum floor. The nurse stood up, her chair scraping loudly against the floor. Is that urine? She asked, wrinkling her nose. No, I gasped, clutching Mark's arm so hard I felt his skin twist. I think my bladder just burst. That was the last thing I said before the darkness of the pain took over. Back in the trauma room, the doctor was shouting at me to push. I can't, I sobbed, shaking my head back and forth on the pillow. I don't know how I'm not pregnant. It doesn't matter what you think right now, the doctor yelled back, his voice cutting through my panic. This baby is coming, and you need to get him out before he suffocates. Push. Him. It was a him. The reality of that word hit me like a physical blow. There was a person inside me, a stranger. I felt a sudden, violent surge of violation. Something was inside me without my permission. Get it out, I screamed, squeezing my eyes shut. Get it out of me. I pushed, not because I wanted to meet my son, but because I wanted to expel the intruder. I pushed with everything I had, fueled by adrenaline and horror. The pressure released all at once. The room went silent for a heartbeat. Then a sound. A wet, gurgling cry. It's a boy, the nurse said, her voice softening. He's okay, he's breathing. I lay back against the pillow, gasping for air, my entire body trembling violently. Here, the nurse said. Mom, look at him. She brought a bloody, purple, screaming creature toward my face. She tried to lay him on my chest. I recoiled. I physically shoved her hands away. No, I shouted, scrambling backward on the narrow bed until my back hit the wall. Don't touch me with that. Take it away. The room froze. Mark was standing in the corner, wearing a yellow isolation gown, his face the color of ash. He looked at the baby, then he looked at me. Sarah, he whispered. I don't want it, I said, my voice shaking. That's not mine, I didn't do this, take it away. The nurse looked at the doctor. The doctor nodded. Take the baby to the NICU for observation, the doctor said quietly. He's small, maybe 5 pounds. They whisked the crying bundle out of the room. Mark didn't follow them. He walked slowly toward the bed. He looked at my flat stomach, now deflated and soft, and then up at my eyes. You knew, he said. It wasn't a question. What? I asked, my teeth chattering from shock. You knew, he repeated, his voice rising. You've been lying to me for months. You told me you were on the pill. I saw you take it this morning. I did, I cried. Mark, I swear to God, I didn't know. Stop it, he yelled, slamming his hand against the wall. A nurse poked her head in, alarmed, but Mark ignored her. You don't get to a delivery room without knowing. What is wrong with you? Were you trying to kill it? Is that why you were drinking? Is that why you went on roller coasters last month? His words were like daggers. Roller coasters. We had gone to a theme park 4 weeks ago. I had ridden the biggest coaster there, 3 times. I felt bile rise in my throat. I didn't know, I whispered, tears streaming down my face. I can't even look at you, Mark spat. He turned around and walked out of the room. I was alone. I was bleeding, I was in shock, and I was a mother. But I didn't feel like a mother. I felt like a monster. The next 24 hours were a blur of doctors, social workers, and psychiatrists. They moved me to a recovery room on the maternity ward. I could hear Bobbies crying in the rooms next to me. Happy families, balloons. I lay in the dark with the curtains drawn. A psychiatrist came in, Dr. Evans. She was an older woman with kind eyes, but I didn't trust her. Sarah, she said, sitting by my bed. The nurses say you haven't asked to see the baby. I don't have a baby, I said, staring at the ceiling. I have a kidney stone. You had a son, she corrected gently. He's healthy, considering the lack of prenatal care. He's a fighter. Mark hates me, I said. Mark is in shock, she said. But we need to talk about you. The social worker is concerned. You're refusing to hold the child. You're refusing to name him. I can't, I said. If I look at him, it makes it real. It is real, she said. It's a mistake, I insisted. How could I not know? I'm smart. I'm educated. I know how bodies work. I had my period. You likely had decidual bleeding, Dr. Evans explained. It can mimic a period. And based on the baby's position, you probably had an anterior placenta. It acts like a cushion, masking the kicks. Plus, if you have a retroverted uterus. Stop, I said. Stop giving it medical names. It sounds like an excuse. It's a diagnosis, she said, firmness entering her voice. But Sarah, you have to make a choice. We can't send this baby home with you if you are a danger to him or yourself. Do we need to discuss adoption? Adoption. The word hung in the air. I could walk away. I could sign a paper, leave the hospital, and go back to my life. I could go back to work on Monday. I could pretend this nightmare never happened. Mark would probably leave me, but I would be free. I need time, I whispered. You have 24 hours before discharge, she said. Think about it. She left. I closed my eyes and tried to sleep, but every time I drifted off, I heard that cry. He's a fighter. Suddenly, the door opened. I expected a nurse. Instead, it was Mark. He looked wrecked. His eyes were red and swollen. He was holding a piece of paper. I went to our apartment, he said, his voice hoarse. I braced myself for him to break up with me. I went through the trash, he continued. I found your tampon wrappers from last week. I stared at him. What? You weren't lying, he said, his voice cracking. You really had a period, or, whatever the doctor said it was, you were bleeding. He walked over to the bed and sat down heavily. I looked it up, he said. Cryptic pregnancy. 1 in 475 women didn't know until 20 weeks. 1 in 2,500 don't know until labor. It's real. I let out a breath I didn't know I was holding. You believe me? I found the receipt from the urgent care, Mark said, unfolding the paper in his hand. From 4 months ago, when you thought you had a stomach bug. I remembered that. I had felt fluttery and nauseous. I went to a walk-in clinic. The doctor pressed on my stomach for 2 seconds. What does it say? I asked. Mark read from the paper. Patient complains of abdominal discomfort. Diagnosis, gastritis. Advised weight loss and probiotics. He looked at me, anger burning in his eyes. But this time it wasn't directed at me. He missed it, Mark said. He touched your stomach and he missed our son. Our son. Mark, I whispered. I can't do this. I don't love him. I don't even know him. I feel like I've been kidnapped. I know, Mark said. He reached out and took my hand. I saw him, Sarah. I stiffened. I went to the NICU, he said. He has your nose and he has my chin. He's really small. He's all alone in that plastic box. I almost killed him, I said. The roller coasters, the wine. But you didn't, Mark said. He's here and he's waiting for us. I'm scared, I admitted. I'm not a mom. I didn't buy a crib. I didn't read the books. I don't know how to change a diaper. We can buy a crib, Mark said. We can read the books tonight, but we can't leave him there. I looked at Mark's hand covering mine. The familiarity of it grounded me. Do you want him? I asked. Mark paused. I want us, he said, and he is part of us, whether we planned it or not. I need to see the doctor again, I said, a sudden thought clarifying in my mind. The one from the urgent care. Why? Mark asked. Because I need to know it wasn't my fault, I said. I need to know I didn't ignore him. I was told he wasn't there. Mark nodded. We'll deal with that, doctor. We'll sue him if we have to, but right now, will you come to the NICU? My heart hammered against my ribs again. Okay, I whispered, but don't make me hold him yet. Okay, Mark said. They wheeled me down the hall in a wheelchair. The NICU was quiet and dark. lit only by the monitors. We stopped in front of an incubator. Inside, hooked up to a few wires, was a tiny baby boy. He had dark hair just like Mark. He was sleeping. I looked at his chest rising and falling. I waited for the rush of love, the magical moment everyone talks about. It didn't come. I felt fear. I felt confusion. I felt a deep, aching sadness for the life I had lost an hour ago. But I also felt something else. Curiosity. "He looks like an alien," I whispered. Mark let out a short, choked laugh. "Yeah, he kind of does." The baby shifted. His hand, no bigger than a quarter, hit the glass. I reached out and pressed my finger against the glass, right over his hand. "Hi," I whispered. He didn't move. "I'm sorry I tried to send you back," I said softly. I looked up at Mark. "We can't name him something normal," I said. "He's not a normal baby. He's a surprise attack." "Felix," Mark suggested. "It means lucky or successful." "Felix." I tested the word. Felix the cat, Felix the cryptic. I looked back at the baby. "Okay," I said. "Felix." The road back wasn't easy. We brought Felix home 3 days later. We had nothing. My parents had to rush over with a car seat and a pack-and-play. My mom was furious at first, accusing me of keeping secrets, until Mark showed her the urgent care receipt. Then, her fury turned to the medical system. We filed a complaint against the urgent care doctor. It turned out he had a history of rushing young women through exams. We didn't get $1 million, but we got a settlement that paid for Felix's college fund and my therapy. And I needed therapy. I was diagnosed with PTSD and severe postpartum depression. For the first 2 months, I went through the motions. I fed him, I changed him, but I felt like a babysitter. I mourned my old life. I cried in the shower every single day. I resented the fact that I never got a baby shower. I never got to prepare. I was robbed of the anticipation. But then, one Tuesday morning, exactly 3 months after he was born, I was changing his diaper. I was tired. My eyes were burning. Felix looked up at me. And he smiled. Not a gas smile, a real gummy, eye-crinkling smile. And just like that, the ice in my chest cracked. I picked him up and buried my face in his neck. He smelled like milk and soap. "I'm here," I whispered to him. "I'm finally here." It wasn't the fairy tale instant connection. It was a slow burn. It was a choice I had to make every single day to be his mother, even though I hadn't applied for the job. Now Felix is too. He's a whirlwind of energy. He climbs everything. He has no fear. Sometimes, when I look at him, I still can't believe he was hiding inside me while I lived a completely different life. People ask me if I want another one. I tell them absolutely not. I love my son more than anything in this world. He is the best surprise I ever got. But the trauma of that night in the ER, the look on the nurse's face, the feeling of my body betraying me, that stays with you. Motherhood is usually a journey. For me, it was a collision. But we survived the crash. If you have ever experienced a pregnancy that didn't follow the rules, or if you struggled to bond with your baby because of a traumatic birth, tell me in the comments. What was the moment you finally felt like mom?